In this video, I'm going to describe refractive lens exchange surgery. Refractive lens exchange, or RLE, involves removing the natural lens of the eye and replacing it with an intraocular lens, or IOL. This can be used to treat nearsightedness, farsightedness, presbyopia, which is the age-related loss of zooming, and or astigmatism. RLE is elective and is recommended to decrease dependence on glasses and or contact lenses when laser vision correction or ICL is less beneficial. We typically use RLE for patients aged 48 or older because by this age, the natural lens starts to lose its ability to zoom for close work and begins to cloud, also known as a cataract. As you age, the lens becomes like an appendix. It's of no value to the patient. RLE is just like cataract IOL surgery, but done to correct vision, not for medical purposes. I perform RLE at our surgery suite with the option of both eyes on the same day. RLE takes approximately 5 to 7 minutes per eye and is done under eye drop anesthesia without needles. You will also be given a relaxing medication by an IV or by mouth. During the treatment, you may experience mild pressure, but no pain. In RLE surgery, we make a small 3mm opening into the eye. An ultrasound unit is then used to break up the natural lens and vacuum it out. An IOL is then placed into the capsule of your old lens, which holds the IOL in place. On the day of surgery, your vision will still be very blurry and you will see various colors, typically red, from the microscope light. You may get burning and stinging for the first 24 to 48 hours as the incision heals. Some RLE patients see great the next day. In others, vision may remain blurry for a few days or occasionally a few weeks, depending on the amount of swelling in the cornea. You will follow up the next day, then usually a week or two later, in our office or with your optometrist. An antibiotic, steroid, and non-steroidal anti-inflammatory drop is used for 3 weeks after surgery. The risks with RLE are low and typically treatable. While there are some serious potential risks of surgery, these are very uncommon. Infection theoretically can occur 1 in 10,000. A serious bleed, called a suprachoroidal hemorrhage, can occur 1 in 40,000. The need for more surgery due to a retinal detachment or intraocular lens dislocation occurs about 1 in 5 to 10,000, and fortunately is very treatable. Retinal detachment risk is increased for patients who have high degrees of nearsightedness, and often I will ask you to see a retina specialist prior to surgery to clear your retina. Less serious risks that can occur a little bit more commonly include inflammation in the eye, swelling in the cornea or loss of the cells in the inside of the cornea, swelling in the back of the eye, also known as cystoid macular edema, ptosis or droopy lid, glaucoma or high pressure, glare or halo, or something known as posterior capsular opacification, where you get clouding behind the lens. Fortunately, most of these side effects are temporary or can be easily treated. With refractive lens exchange, in order to maximize your vision, we may have to go back with laser vision correction or a secondary lens. The need for more surgery is particularly common if you've had previous radial keratotomy or LASIK, since the corneal power, which is used to determine the IOL power, is more difficult to precisely determine. In summary, refractive lens exchange is a safe and effective alternative to correct your vision. In fact, you should think of refractive lens exchange as just like LASIK. Your experience and your visual outcome will be identical. When my own mother came in for LASIK, I determined that refractive lens exchange would be a better procedure for her, and it's what I did to her eyes.